Hi, my name is Emma, and I will be doing my health assessment lab practical today here with Zachary. The first thing I'm going to do when I walk into a patient's room is to perform proper hand hygiene. This involves washing my hands with soap and water for a minimum of 30 seconds and drying thoroughly. Then I'm going to close the curtains in the patient's room to ensure privacy, and then introduce myself. Hello, my name is Emma, and I will be your student nurse today. Could you please tell me your name?
My name is Zachary.
And where are you right now?
I'm in my apartment.
And what month of the year is it?
It's July.
His responses indicate that he is alert and oriented ×3. Now I'm going to analyze him using the Glasgow Coma Scale. When I walked into the room, his eyes opened. This gives him a score of 4. His verbal responses indicate that he is oriented, which gives him a score of 5. I am now going to assess his motor functioning. Could you please squeeze my hands with your hands. His ability to follow a motor command gives him a score of 6 for motor functioning and a total score of 15. I'm now going to ask him what brought him in today. Could you tell me what brought you into the hospital today?
Yeah, I've been having some blurry vision.
Could you tell me about a little bit more about that?
Yeah, this morning when I woke up, I just noticed that I couldn't see like I normally had been.
And about what time was the onset?
Around 8 a.m.
And about how long did it last?
Just about a half an hour.
Was it with one or both of your eyes?
It was both my eyes.
Did you have any other symptoms that are accompanying it?
It was just that.
And do you wear prescription glasses?
I do.
Have you had any head trauma recently?
No.
Now I'm going to ask him a few more questions. Do you have any allergies that you're aware of today?
No.
Do you take any medications at home?
I do not.
Do you take any over-the-counter medications, herbal remedies, or supplements?
No.
And do you have any bits of your medical history that you'd like to discuss today?
No.
Now I'm going to move on to the vital signs. I'm going to begin with taking his blood pressure using the 2-step method. The first thing I'm going to do is apply the blood pressure cuff. I'm going to feel for his radial artery, inflate the cuff, and as I deflate the cuff, I'm going to watch the barometer and feel for when the radial pulse comes back. This is my estimated systolic blood pressure. Then I'm going to let the arm rest for a little bit, reapply the cuff. Using my stethoscope, I'm going to place the diaphragm onto the brachial artery, inflate the blood pressure cup 30 millimeters of mercury beyond my estimated systolic blood pressure. And then as I deflate, I'm going to listen for the systolic and diastolic readings. I'm then going to take his oxygen saturation using a pulse oximeter. I'm going to take his pulse using his radial artery, counting full 30 seconds, multiplying ×2 if the pulse is regular. If irregular, I'm going to take the pulse for 60 seconds. Then I'm going to take the patient's arm, lay it over their chest, and count their respiratory rate. I will also be taking the patient's temperature and assessing for pain. Then I'm going to do a general assessment of peripheral circulation by looking at the patient's skin color. I will also be looking at capillary refill and assessing the temperature of the skin using the dorsal side of my hand. I will now be moving on to taking the patient's pulses. I will be grading these from a score of 0 to 3. 2+ is the normal finding for pulses. I can take the pulse temporally, on the brachial pulse, the radial pulse, the carotid pulse, the femoral pulse, and the popliteal pulse, posterior tibial pulse, and the dorsal pedialis pulse. I will now move on to the thyroid gland assessment. Standing behind the patient, I'm going to be using my fingers to feel for the thyroid gland, pushing slightly from side to side. Next, I will be assessing the lymph nodes. I'm going to be feeling for the lymph nodes. They should be small and slightly movable. I will look at the pre-auricular lymph nodes, post-auricular lymph nodes, submental, submandibular, jugulo-digastric, superior cervical, deep cervical, posterior cervical, supraclavicular, axillary, epitrochanter, and inguinal. Now I will be moving on to the cranial nerve assessment. I will begin with cranial nerve 1, the olfactory nerve. This is a sensory nerve, and I will have the patient close their eyes and I will let them know I will be putting something underneath of their nose and having them smell it. You want to use a familiar scent. I can use something like peanut butter or coffee grounds for this test. The second cranial nerve I will be assessing is the optic nerve. This is another sensory nerve. I'm going to use the confrontation test to assess this nerve. At the same level of the patient, I'm going to have them cover the eye, their left eye and my right eye needs to be on the same side, and have them verify that they can see my fingers along 4 different planes. Next, I will be assessing cranial nerves 3, 4, and 6, the ocular motor, trochlear, and the abducens nerves. For these, I will be using the Perla test. I want to observe that the pupils are equal, round, and reactive to light. I will use a visual assessment to see that the pupils are equal and round, and then I'll be using a pen light to assess whether or not they're reactive to light. A normal finding would be that the pupils constrict when the light is reflected into their eyes. Next, I will be testing cranial nerve 5, the trigeminal nerve. For this test, I will be using the cotton wisp test. I'm going to be telling the patient to close their eyes and let them know that I will be touching their face with a cotton swab, and I would like them to point to the location to which they feel me touch their face. You want to make sure that you hit each of the branches of the trigeminal nerve. Next, I will be assessing cranial nerve 7, the facial nerve. For this test, I'm going to have the patient smile. You want to be looking for symmetry here. For cranial nerve 8, I'm going to have the patient stand up, and I'll be performing the whisper test. Standing behind the patient, I will whisper 3 different words and instruct the patient to repeat after me.
Basketball, soccer, football.
Next, I will have the patient sit back down, and I will assess cranial nerves 9 and 10 by looking into the patient's mouth and observing the uvula. I would like to see the uvula in the midline of the mouth. Could you please say ah?
Ah.
Now I will be assessing cranial nerve 11. I'm going to have the patient shrug their shoulders. Now I'm going to apply resistance with my hands and have them shrug their shoulders again. And now could you move your neck side to side like so? I'm going to place my hand on your face and apply some resistance. Could you please press against it? For cranial nerve 12, I will have the patient try to move their tongue around. Could you please stick out your tongue and move it around, please? These are all normal findings. I will now be assessing cerebellar function. Could you please stand up? We are going to perform the Romberg test. I'm going to instruct the patient to stand upright with their hands by their side and their feet together. The patient should be able to do this with minimal swaying. If the patient were to stand to the side or fall over, this would be an abnormal finding. Now I will have the patient do a finger to nose test. Could you please sit back down? I'm going to have the patient stick their arms out, point their index fingers out, and touch their nose one at a time, back and forth with increasing speed. Now I'll be doing the kinesthesia test. I'm going to explain to the patient that I'm going to be moving their finger up and down with their eyes being closed And I would like them to let me know when it's up and when it's down by saying up and down. Could you please close your eyes?
Up, down, up, down.
Now I'm going to be doing the Sterignosa test. For the Sterignosa test, I am going to have the patient close their eyes and I'm going to place a familiar object in their hand and ask them to identify it.
Pen.
Thank you. And now I'll be doing the graphesthesia test. For the graphesthesia test, I will again ask the patient to close their eyes, and I'm going to draw a number in their hand with my finger and ask them to identify what number it is.
6.
These are all normal findings. I will now assess the deep tendon reflexes using my reflex hammer or ice cream scoop. The first deep tendon reflex I'm going to do today is the brachioradialis test, or brachioradialis deep tendon reflex. I'm going to locate the brachioradialis tendon, have the patient relax their arm, and hit it slightly. You want to see a slight flexion and supination of the hand. Next, I'm going to be testing the bicep deep tendon reflex. This is located at the end of the bicep head right here. Using the reflex hammer and the arm relaxed, I'm going to hit the bicep tendon here and again be looking for that slight flexion. Now I'm going to be doing the tricep deep tendon reflex. I'm going to support the patient's arm and have them completely relax their arm. I want to be supporting it entirely. I'm going to use my reflex hammer and hit just slightly above the elbow. You want to see a slight extension of the arm in this reflex. Now I'll be doing the patellar reflex. With the legs dangling from preferably a higher position from here, you're going to take a reflex arc and hit right on the patella. For this test, you'd like to see a slight extension of the leg. Now we'll be doing the Achilles deep tendon reflex. When doing this test, you want to support or hold the foot in a dorsiflex position. And using your reflex hammer, you want to hit at the Achilles tendon. You want to see a slight extension of the foot. And then I'll be doing the plantar reflex, or the Babinski reflex. You want to move up the lateral side of the foot, across and back down middle, and you want to see the curling of the toes. This is a normal finding. I'll do it once more. This is a normal finding. I will now demonstrate an abnormal finding. With the abnormal finding, you saw the fanning of the toes. This completes our assessment. Thank you.